Today, I am going to talk about, just briefly talk about self-care for providers. It's just as a way to teach the people that we serve the same realistic practices that we are putting effort into in order to continue to be labeled as essential workers, if you know what I mean. So with that being said, I'd like to recognize that as providers, we are human, okay? The human condition is something that is really important to recognize simply because throughout this pandemic, we might have been put on robot mode. For those of us that have not had job loss, that have had an increase in job demand, automatically we put our mental health and our physical health on the back burner, and we do become more robotic. So I just wanted to make sure to point out that first and foremost, we are human. So as providers, we are not just out in the communities helping other people. We are also personal providers for our children and for our extended families and our friends. So we need to make sure that we also are recognized that provider doesn't just encompass profession, it also encompasses personal. So what's happening in our mental health and wellness during this pandemic? There has been a huge decrease or increase in distress from the pandemic. It comes in a variety of different areas, like wearing several hats, like being a parent while you're at home working, doing telehealth, and also doing the job, not the job of the teacher, but also having to monitor your own children while they're doing their Zoom meetings over virtual learning. Zoom fatigue, lack of socialization due to quarantine, job loss, and then on the other end, there are the job demands for those that are deemed essential. So with this, what I found is that just a few statistics. Anxiety and depression there's been an increase by 40%. Crisis calls and crisis assessments have increased 30 to 40% compared to pre-COVID, where we're not post-COVID. During COVID, 4 of 10 adults in the US have reported anxiety and depressive symptoms increase. Prior to COVID, there was only 1 of 10. So that's a huge increase. Since July of 2020, there have been reports of sleeping difficulties, binge eating increases, alcohol and substance use has increased, chronic physical health conditions have increased due to the pandemic. This is just a graph from the Kaiser Family Foundation that showed that prior to the pandemic, January through June, that 1 in 10 adults was reporting the depressive and anxiety symptoms versus January 2021, very, very recent, because we're in March, where there is a significant increase in that area as well. More stats on the COVID effects. There's been about a 56% increase in reporting of depressive and anxiety symptoms for transitional age youth, like ages 16 to 26. They're also known as TAY. Compared to all adults overall, TAYs have a higher reporting rate of increased substance use and suicidal ideation. About 53% of adults with job loss or decreased income, so going from a 2-income household to 1, they've reported having higher rates of mental health problems than those that have not had a job loss, which still lie at 32% reporting. The effect of COVID on parenting and children. So daily routines, of course, from experience, they have been disrupted due to school closures, either that or they have some kind of hybrid where you have to go in one day and the other, and it's just like a lot of rigor. So the need for parents to work from home is an issue. Due to this, there's been a reported increase in concerns from parents about emotional well-being of children. And since the pandemic started, it has also been determined that women and children are more likely than males to report worsening of mental health symptoms. There is a slight increase in mental health problems in households with children under the age of 18, and then versus homes without children. The Kaiser Family Foundation polls report that homes with children report at 45% of the time, whereas homes without report 41%. So what do we do with this information? Today, the whole point is to discuss self-care as a way to teach the people that we serve to continue to build resilience and persevere through this pandemic. So I have this picture here, and it's very purposeful. What are other words for regularity? And they have a lot of synonyms in here for regularity. There is a word in here, or that's not in here, that I intentionally avoided because it's triggering. I don't know if it's triggering for a lot of you, but the word normal or normalcy is a little triggering for me during this pandemic because we don't know what normal really looks like. But we can know what steadiness looks like, and evenness and balance or regularity, routine. Those are things that we can focus on to help better ourselves so we can better serve the people that we're working with. So the importance of routine during the pandemic is very necessary. Our biological clocks need routine in order to regulate mood. If imbalance occurs, mood episodes may follow. Okay, if you already are prior pandemic, already are subjected to things like compassion fatigue or depersonalization, or any of the symptoms of burnout that might lead to some depressive or anxiety symptoms or other mental health symptoms, those things might become a lot bigger and more dysregulated. So I would just like to offer some tips for improving regularity. Regulating sleep hygiene by getting up at the same time daily. Now, if you are a provider, and this is easier said than done. If you're a provider and you know that you're in one of those households that have had increase in anxiety because you've had a decrease in income, but you're still working, and you have children at home that you have to continue to work with, and you can't get a lot of sleep, you can't get the recommended 8 hours of sleep for an adult, well, you could still try to regulate your sleep. If you have to go to bed schedule yourself to go to bed at 11 p.m. at night, then schedule yourself to do that and get up at 5, that's 6 hours of sleep. It's not a lot of sleep, but at least it will be something that is routine and regulated for you. And you can look forward to that. Your body needs to be able to rejuvenate itself. Exercising daily is something that is very important. Since the pandemic, a lot of people have become sedentary simply because they've been quarantined. And then there comes the lack of motivation with that. So working out may not even be it may not be on the top of your list to do. So if you can do little things like when you go to the grocery store, if you're not ordering from a delivery service, when you go to the grocery store, park farther away from the door to walk, take the stairs instead of taking the elevator at work if you're going into your building to work. Clean your house, make sure that you're walking around more, taking regular breaks in between sessions or in between client visits or things like that. Just make sure that you're doing some moving, because even doing like chair yoga or doing something like this will be able to help you a lot more in getting endorphins released. And endorphins released make you happy, because it releases a little serotonin. So you will be able to combat at least a little bit of the depressive symptoms you might be experiencing yourself as a provider. Having regular meal times is a really big deal. Scheduling your eating simply because we have been quarantined. We might eat out of boredom. We might eat out of emotions. We might just, eat to stay awake because we are exhausted. Try to, if you have something where you can write down, or you can, an app where you can easily record your meal times and what you're eating, that might be helpful. If that is just too overwhelming for you, at least have a timer where, if you don't feel hungry, at least have something to eat to sustain your energy level, because we need to be alert and awake and be healthy, and consult with your doctor to make sure that, what you're doing is best for you. Schedule and plan socially distant interactions, whether introvert or extrovert. So like human interaction is necessary, it helps combat, some of those depressive and anxiety symptoms, depending on the company you keep. So you want to keep good company. But try to schedule and plan socially distant interactions while following the CDC guidelines. This right here, I put up because it is really good to not only look at your mental health and your physical health, but the other 6 dimensions of wellness when you, while you're getting through this pandemic. According to Stowen, and this was printed in 2017, it says, wellness necessitates good self-stewardship for ourselves and for those we care about and who care about us. For those in helping professions such as us, wellness is a professional as well as personal responsibility. In order to ensure high quality patient or client services, we have the ethical obligation to attend to our own health and well-being. Sufficient self-care prevents us from harming those we serve, and no situation or person can justify neglecting it. So, in this picture, sorry about the ums. In this picture, we've discussed a little bit today about regularity and the necessary part of that to maintain or to cope effectively with life. The emotional well-being, but we've also talked about physical, like our biological clock. But we definitely need to concentrate on diet, sleep, and nutrition. But there's also the intellectual component of wellness that we can concentrate on. And this particular part of wellness, it's basically maintaining like your curiosity about all there is to learn, trying to turn off the TV about the pandemic and all the political stuff, and try to focus on something that will help you learn something new, and that's refreshing. And then you have the environmental part of wellness, which is understanding how your social, natural, and built environments affect your health and well-being. There is the financial component of wellness, which is huge because the pandemic has put such a financial lean on our lives, but managing your resources. So when I say managing your resources, that means that you have to reach out to get the resources, just like the people that we serve. If they apply to you, then that means the resources are for you, and we need those. Okay, so don't be afraid to reach out to get the things that might be out there in abundance, but you're worried about, well, I'm not going to do that because I'm in a better position than the people that I serve. And no, right now, if you're not able to take care of yourself, you won't be able to take care of them. So reach out for financial help if there is some in your area. The vocational part of wellness, like preparing for and participating in work that provides personal satisfaction and life enrichment. Some of that is possible right now, but may not be recognized because we're on robot mode with helping our persons that we serve. So try to take a step back, day to day, and think about something good at your job, like something that you appreciate about where you're working right now, something that you want to improve on, and then another thing that is good that you appreciate. So you can try to build up some sense of personal achievement, maintain compassion for the people that you serve, just so you can avoid burnout. Reach out to your EAP. That's absolutely necessary if you are experiencing work-related stress. Lean on EAP. I'm sure there's been a high increase in EAP calls due to work-related stress. There must be, but I haven't had time to do the research on that, but I can only imagine. The spiritual dimension, expanding your sense of purpose and meaning of life by participating in activities that are consistent with your beliefs and your values, whether that's church via, Zoom, or if you're doing socially distant church now that it's warmer out in the park, or listening to whatever music that, uplifts your spirits, or burning candles, or whatever realm of spirituality you have, if that is applied to you, do that. So these are, I wanted to show you, let me go back here. These are absolutely necessary to focus on when you are looking at self-care. And let's see here. There is, oh, that's in the way. One moment, I'm trying to get out the way. This right here is from the Substance Abuse Mental Health Services Administration, and it is a PDF that you can find online that will help you if you need a tangible piece of paper to just go ahead and write down things about your wellness. It will help you step by step to acknowledge your wellness and the things that you need. It talks about creating balance, embracing support from others, valuing routines and habits, and all of the above that we possibly spoke about. It gives you some statistics, and then it gives you some charts to write down things that you will do and then what you need, so you can focus on the different areas of wellness. And I can put that in the chat. Oh no, let me go. Okay, so what I would like for you to take away is that we are human, okay? We're not robots. Routine, even during the pandemic, is key to persevering through it. However, expect the need for flexibility, because wellness is ever-changing and fluctuating process. Self-care is extremely important as provider, both professionally and personally. I put this picture, there's so many of us, so I usually would ask, and I use this as a teaching tool for a lot of my sessions with regards to parenting and those parents that have a hard time helping themselves before their children or anyone else. In this picture, you will see that they are on a plane, and that there is a young lady that has put her oxygen masks on her face first prior to putting on the child. That is very important, and this picture is really representation of self-care, because if, let's say this was you put the mask on the baby first or the child first, and then you pass out, then who is going to care for the child? No one's going to be around to care for the child. So it is best that you do self-care first, so you can be at try to get to your optimal, so you can provide the best care for your child. And these are the references. This is quick and sweet. These are the references that I used while gathering information.